So should I be getting my hormones tested? That's a question you've been asking yourself. It's actually a legitimate question. And the reason is because your body functions, again, as a unique machine. Everything connected, everything works together in a synergistic manner. And hormones is just one of them. So when you sit there and you're premenopausal, your hormones function differently than when you're menopausal. And from that perspective, you start to see, if I sit there and my hormones are dropping off because I'm menopausal, you start to see the effects of that lack of hormone. That's why it's actually very important, even if you sit there and you're premenopausal or menopausal, to actually have your hormone levels evaluated appropriately. And that doesn't necessarily mean just, oh, I'm going to check my estrogen levels, I'm going to check my progesterone levels. It means looking at some degree from a functional perspective. You're looking at what they call a Dutch test. And the Dutch test actually will give you more information about how your hormones actually are functioning. Do you have too high of what they call a cortisol level? Are your stress hormones too high? Are you sleeping well? What other issues are going on from a hormonal perspective that you're not aware of, that just by checking a couple of blood tests? You really need to understand how the entire hormonal system actually works in order to properly determine how is this hormonal issue, is it balanced, is it not balanced, how is it impacting body's function as a whole.